Good evening and welcome to our COVID-19 update program. I am Ladi Akeredoluale. Here are the highlights at this hour. House of Representatives criticizes federal government decision not to reopen graduating classes and pull out of WAEC. Back and forth over doctor strike in Lagos as Governor Sanwo-Olu says hazard allowances have been paid. And several countries, including Madagascar and Morocco, reimpose lockdowns after a surge in COVID-19 cases. We start off in the nation's capital, Abuja, and specifically from the House of Representatives, where the lawmakers are asking President Muhammadu Buhari to direct the Ministry of Education to ensure that students in unity schools participate in this year's WAEC examination. The decision of the House is coming on the heels of a pronouncement by the Minister of Education that no Nigerian school will participate in the senior secondary school certificate examinations earlier scheduled to hold from August the 3rd to September the 5th, owing to the COVID-19 pandemic. Our correspondent Terry Kumi has more.
The directive by the Federal Ministry of Education to public schools to boycott the senior school certificate examination scheduled to commence from the 3rd of August has caught the attention of the House of Representatives. It was raised as a matter of urgent public importance by Representative Naji Noli, and according to him, that decision was not well thought out.
Worried that Nigerians' non-participation in the year's examination portends serious psychological, socio-economic, and health effects on the students as well as the already overburdened parents and guardians. Also worried that the negative and cumulative effects of the government action in seeking to withdraw Nigerian students from the examination will be devastating on our educational system and Nigeria's economy at large.
The West African Examination Council is the body which determines the examinations required in the English-speaking West African countries, which include Ghana, Nigeria, Sierra Leone, Liberia, and the Gambia, for award of the junior and senior secondary school certificates. While the Ministry of Education insists that it is not prepared to risk the lives of Nigerian students during the COVID-19 pandemic, the House fears that it could portray a negative image for the country.
Also worried that this sudden policy reversal is and will be detrimental and create further confusion and uncertainty in the educational sector, as well as frustrate the students' lifelong ambition and send wrong signals to stakeholders and investors.
The examinations were initially scheduled to commence on the 5th of April this year, but postponed to the 3rd of August due to the COVID-19 pandemic. The House also resolves to urge the Ministry of Education to implement the national safety protocols on COVID-19 to ensure safety of students during the examination. Terry Ikumi, Channels Television News.
From Abuja to Imo, where the government there says several tests have been carried out on residents to ascertain their COVID-19 status. Briefing journalists at the end of its first phase of assignment, as it was called, Professor Maurice Iwo, the chairman of the state's COVID-19 committee, says it will not relent until the curve of COVID-19 is flattened. Our correspondent, Eitokwe Kutayi, has more.
The COVID-19 task force in Imo State has ended the first phase of its assignment and submitted an interim report to the state government. Between March and July, the state was able to carry out over 2,000 tests with 399 positive cases recorded in the state. The chairman of the COVID-19 task force, Professor Maurice Iwu, sheds more light on the task force's next line of action to combat the coronavirus disease in the state.
We have collected a total of 2,064 samples, out of which we have gotten 1,925 results, 399 positives, 1,525 negative, and we still have 117 results still being awaited. As you know, we are testing more than most other states near us. We have 2 test centers in our state, one privately owned, the second one at the Federal Medical Center, Owerri. So we are lucky that we have more tests being done. We are now, as I said, in the second phase of our fight against this virus.
Only yesterday, the Imo State Governor Opuzodima visited the new NCDC Emergency Operations Center in Owerri. This is in a bid to create more awareness for the COVID-19 pandemic with a view to tackle this virus headlong. From Owerri, the Imo State capital, Eyitope Kuteyi for COVID-19 updates.
We go to Jigawa State, where the government there has given a one-year tax holiday to small and medium-scale enterprises whose businesses suffered owing to the resultant confusion of COVID-19. The Commissioner of Finance in the state, Babangida Umar, confirmed this to newsmen in Dutse, its capital. According to him, only those business owners with a registered business name will have a benefit from the gesture.
Dutse, the Jigawa state capital, is full of activities as residents are back to their normal lives. To cushion the effect of the dreaded COVID-19, the state government has announced a one-year tax holiday for categories of business owners.
We small-scale business people, we really suffered under this lockdown. Our businesses suffered, which we are yet to recover. So we thank this government for showing its concern on our plight.
We have not had people that have a good purchasing power. People have not really been coming up. Business has not really bounced back. So I think it's a good development for many of us. That will give us a little rebate on what we have lost for a few months while sitting there at home.
The Commissioner of Finance, Babangida Umar, says the government's effort will go a long way in assisting small businesses who are mostly affected in the society.
One-year tax holiday from 1st July 2020 to 30th June 2021 as incentive to all existing small and medium-scale enterprises, business names only, whose businesses suffered as a result of COVID-19 pandemic.
While the government continues to support the economy with palliatives, the hope is that these beneficiaries will use the opportunity to bounce back on their feet.
It's the second day of the warning strike called by doctors under the Medical Guild in Lagos State over issues affecting their welfare and safety. The state government is appealing to the doctors to return to work, but they insist that the issues involved are recurring and unresolved. Our correspondent, Dari Dowu, examines why the medical professionals in the government have been at loggerheads despite ongoing talks.
To activate the resolution of the Congress on the 3-day warning strike.
It's a warning strike expected to last for 3 days. Doctors working in the state COVID-19 isolation centers are joined in the long list of issues, but exempted from joining the action called by the Guild. A visit to the Lagos State University Teaching Hospital shows skeletal medical services are rendered with priority given to emergency cases only. It's a peculiar time in medical profession, and Lagos, the epicenter of COVID-19, cannot afford a dispute with frontline workers. The state government says it is disappointed over the action of the doctors for downing toll, especially at a time like this. The governor wants the doctors to show empathy and return to work.
We needed to be sure that the people that were going to be paying the COVID allowance to were people that had worked during this COVID period and had worked in one or all of our isolation centers, right? So we had a 2-month delay, meaning that we paid 2 months, then we had not paid May and June. As I speak this morning, all of them, most of them, if not all of them, are getting the allowance for the 2 months arrears.
2 months are being owed these doctors. As I speak to you, I've not gotten feedback yet whether they have received it as at today. But I know that as at yesterday, these same doctors working in isolation centers are yet to receive 2 months pending of these allowances. As we have always held to the fact that every doctor is a frontline doctor. You can't say only those in isolation centers. We've been attending to patients with COVID-19.
When the doctors decide to return to work, a list of issues they want resolved may still be hanging. Many of them bordering on pending welfare issues and safety of those on the front line.
Within Lagos alone, you have 5 tertiary health institutions. And you find that in these institutions, they are employing their doctors, their residents, medical officers, on Commerce 3, Step 3, which is equivalent to grade level 13, Step 3. Whereas for Lagos State, we are being employed at a level of grade level 12.
Any of us, especially them at this time, we want to take an opportunistic approach because of the pandemic system or the pandemic crisis we're going through. I think it's rather unfortunate.
The guild says the strike was inevitable after the government failed to meet 70% of its demand. The Congress is expected to reconvene after the 3-day warning strike to review its plan. It is unclear whether the government's current intervention is enough to change the course of action. Dare Ido, Channels Television News.
In neighboring Ogun State, the government has called for an attitudinal change among residents in order to reduce the spread of COVID-19. Its Commissioner for Health, Dr. Tomi Koka, gave the charge while explaining those factors responsible for the higher figures recorded in 2 local government areas of the state since the virus was first detected.
The fight against coronavirus in Ogun State is one campaign the state government says it's taking seriously with a determination to flatten the curve. Isolation centers and molecular testing centers have been established in 3 senatorial districts. Despite this and other measures put in place, 2 local governments, Adodo-Ota and Shagamu local government, have recorded 496 and 265 cases respectively. The virus spikes in the 2 local governments have been attributed to community transmission.
There's still need for more orientation and for our people to cooperate with the government in the area of complying with the guidelines.
Compliance to safety practices like social distancing, wearing of masks, among other precautionary steps, are still being flouted by the residents. But the government says it is intensifying prevention advocacy.
We have to ensure that you protect yourself and you protect your neighbor. Once we take personal responsibility, then we have a better chance of actually conquering this coronavirus and hopefully sometime in the future eliminate it from our society.
With close proximity to Lagos State, the epicenter of the coronavirus pandemic, the authorities in Ogun State say they are taking the gospel of staying safe and taking responsibility to all the residents of the state.
Muslims in Ekiti State are backing out of support for the planned resumption of religious activities. They are citing conditions set by the state government before public worship can take off. In the meantime, Christians are forging ahead, trying to negotiate and deal with securing some concessions from the government. Babajide Agbeo has more.
As announced by the governor of Ekiti State, Dr. Kade Fayemi, some weeks ago, religious activities will be resuming this weekend in the state. However, Muslims in the state have come out to say they are suspending their own resumption for now. Their leaders met over this and they came out with a position that the conditions set for it, they don't want to pretend they can meet those conditions. And for now, they will be praying at home. But for Christians, they are set to resume. But there are still some issues around this. The first issue is the rumor making the rounds that the state government is trying to levy churches for fumigation, exercise, and certification. But the State Ministry of Environment has come out to debunk this. The ministry has stated clearly that religious centers have been told that they are to carry out the exercise by themselves, as the ministry will only supervise and certify, and this will be at no cost.
I want to see it as hearsay, yes, because and that had warranted our giving a press release on this, for people to know that government is not charging anything. All that we are doing, all the services that are going to be rendered should be seen as service to humanity. And we have stressed this so many times at our meetings, at our gatherings with the religious leaders, for them to know that government, in whatever form, will not be charging anything.
In the meantime, community testing is in progress in the state across the 16 local government areas. 4 local governments have been covered so far. These are Ikere, Iseorun, Emure, and Bonyin local government areas. And 14 new cases have been discovered in that process. The State Ministry of Health has again advised people not to let down their guards at this time, as the war against COVID-19 is not yet over. Babajide Agbeyo for COVID-19 update.
Thank you, Babajide. Now, we spend a lot of time talking about COVID-19 infections and treatment, but what happens when people survive the virus, get treated, and are asked to go home? What becomes of them afterwards? The post-COVID rehabilitation and recovery process. Well, I have with me one of those lucky people in the studio here, former presidential spokesperson, Dr. Doyin Okupe, who is himself a medical doctor. Thank you for being with us.
Good evening.
And congratulations once again.
Glory be to God.
Now, the last time we spoke, you had just left the isolation center and you were home and it was still fresh. That was a few weeks ago.
Yes.
What has been the experience like post your treatment?
Are you talking about clinically or
no,
socially?
Both clinically and socially. First, clinically.
Clinically, like all diseases, there's a recuperation stage. When you are discharged and you have tested negative, what it means is that the presence of the virus in your body has actually been more or less wiped off. But that does not mean that that is the end of your physical condition, because while you are under attack of the virus specifically, now we know much more and more
about it.
Yeah, it attacks various organs in your body, and even when it has died and it has gone, some of those damages may be slight, may be profound, but they leave some things in their trail. So it is not unusual for weakness to continue. I had there were occasions, there were times when I thought, has this thing really gone? But usually, it's not just my experience, because I also asked other people. They're transient, like you could just start to cough, all right? Or for a long time, I had phlegm. I brought up phlegm, even though I was not even coughing in the hospital. But when I left, I brought up phlegms and things like that. So invariably, though you are not infected, but you are not totally, except for very young people. I mean, I've seen young men, get hit with, COVID-19. For 2 days they're down, third day they're up and about. But for the older folks, especially people with comorbidities and things, it's not that simple. It's not that easy to return. It's not, for a fact. It's not.
When you were leaving, because a lot of people don't know about this part, so you're providing a lot of information that a lot of people don't know. When you were leaving, were there certain things you were told to do, and there were certain things you were told not to do, so that the recovery process, as you put it, was complete?
Definitely no. Both the patient and the caregivers are just as excited as, once you get the two negatives, they say, oh, congratulations, you can leave. Because there are people actually hanging
almost like waiting.
Exactly, waiting to take your bed. That is the situation in many places. So, and, really also, except for very, very severe cases, which is less than, maybe is less than 10%, very, very severe cases where people have to go on oxygen therapy or, some interventions and all that. You really do not have too much debilitation. There's not too much debilitation and, prostration as such. So, because the virus itself, has empirical manifestations,
right.
Fever, cough, runny nose, body pains, loss of appetite. These are not things that really weigh a person down. But if you have cardiac issues prior to that infection, right. Or if you have diabetes, like I had, prior to that infection, there are issues.
That complicates things a little.
There are issues, and you may have to, you don't even need to be told. You just, in my own case, normally I do a 30 minutes walk, every evening, around my house. But when I left the clinic, it wasn't, you know, I had some measure of fatigue. I did have some measure of fatigue.
Let me put you on pause, Dr. Okupe. We'll take a break here. And when we return, I'll be asking Dr. Okupe if, in terms of what has happened to him after he was discharged, socially, what people talk about, stigmatization and so on, what his experience has been like. Please stay with us. Welcome back to our studios and our COVID-19 update. Before the break there, we're talking to COVID-19 survivor, Dr. Doyin Okupe. Dr. Okupe, before the break, I said I was going to ask you about something that that makes a lot of people not want to talk about COVID-19, either as patients or as survivors and so on, the issue of stigmatization. That brings itself out socially.
Yeah.
A lot of people tend to stylishly want to not. What has been your experience? Have you witnessed any of that?
Yes, I did. and I find it quite funny. You know, when I was leaving the hospital, I mean, of course, my family members and everybody was, they were anxious. They saying, "Doctor, please, don't allow people to come to your house, net. You know, just rest and this and this and that." But what I actually found out was that people are not even too interested in coming to my house. So, you know, and that's the truth, you know, and because, you know, erroneously, people feel that, you know, somebody who has had COVID and has been, even though he has turned negative, that, you know...
He still presents some kind of danger.
There's, you know, and this one, we know that he had COVID, so why move close to the person? You know, I mean, in one occasion, I had to actually tell a very close friend of mine that, listen, you know, I am the lucky person. You are the one to worry about COVID. You know, I've just removed my mask to make a point.
That's right.
You know, that I don't need to be protected anymore because I cannot infect anybody and nobody can infect me. At least, you know, so far we know that there's scientific evidence now, you know, that when you have COVID and you have turned negative, the antibodies are in your body. What we do not know medically and scientifically is how long it will last. Okay, that will take some time. But as I sit with you, it will be difficult for you to give me COVID, and I can definitely not give you COVID. But, you know, the stigma is there, and it's unfortunate. You know, those who have had COVID, you know, should be the superior people because they are the ones that actually have had them, you know, themselves, you know, sanctified, so to speak. You know, if you haven't had it, you know, you are the problem. No, you know, I am not your problem. I am not your problem. Do you understand? So actually, you know, people should be wary of getting close to you, but people should
not to you.
To me, you know, I have both a scientific certification and a moral and social certification that I cannot infect anybody. And you know, but you know, this is why I know, you know, I get in an average of 10 calls a day, and I'm talking seriously. I get an average of about 10 calls a day from associates, family members, people who think that there's something has gone wrong. And when I say, why don't you go to the association? I say, no, I'm not going to anywhere. Do you understand? So there is a problem in the society. People still feel that, these things, you're not supposed to let people know you have it. You know, I keep saying it. It is not your fault that you have it. It is not because of some funny behavior or some, lucidness or something. You know, this is just something, if we are not very careful, a majority of us will eventually and invariably get it and move on. You know, I know for a fact that today, even though the numbers are increasing astronomically, those who are reporting are less than 20% of those who are actually infected in the country. That's the truth. But people, we still need to do a lot of work, talking to people and telling them, this issue of stigmatization is not
helpful.
Yeah, it's not helpful. And, really, those who actually have COVID also need to have confidence in themselves. I mean, me, I'm a doctor, I understand the whole thing, and you cannot put me down. It's not possible. You know what I mean? Because I know what has happened, and I know that, I am better off than a person who's never really had COVID. And if you do have COVID also, you should not be worried or weary of going to the clinic or going to the isolation center, because at the end of the day, You're still looking at, I mean, in Nigeria today, our figures, I've watched it consistently. We are less than 3, I mean, the number of deaths is still consistently less than 3%, consistently. 2%, 2.25. That is where it oscillates. So, I mean, it's not, I mean, like, you know, when, God forbid, if you're part of that 2.25, it is extremely very painful and hurtful. But, you know, it is reassuring enough to let people know that, you know, almost 98% of people who have COVID will get back home without any problem.
This is very important.
It is.
And people like you consistently talking about it, break that stigmatization because you're very senior members of your profession, you're very senior members of the society, then you happen to be a doctor as well, a medical doctor at that. But before I let you go, I want to ask you about what you mentioned last.
Yeah.
And how important you think it will be going forward. We haven't done that many tests.
No, we haven't.
Especially relative to our population.
I was just listening, you know, Egypt, they said they've done about 250,000, you know, tests. You know, I mean, we are so far from that, very, very far from that. We haven't done enough tests.
And therefore,
but it's creeping. I mean,
the
we're
question
going
is,
up.
what do we need to do to get more people to go for these tests? Because they say there are about 40 labs across the country, but many of them are idle because nobody is showing up to present themselves.
There are two things I found out. One is accessibility. You know, it took my personal intervention to get a friend to get tested. You know, he had gone everywhere. He had telephoned he had used all the telephones. He was so, he just called me, and said, look, Doc, this is my issue. I've been down for 3 days. These are my problems. These are my symptoms. And I said, no, definitely you have COVID. And I had to do one or two things, and he got tested and he got admitted into the isolation center. So there are a lot of people like that who will not go through all that wahala.
Right.
All right. Now, there are also people who feel that there's not much that is being done for people at the isolation centers. And that therefore, why should I bother myself? I know the drugs that I'm using, and I can do all the other things and I'll be fine. And in most cases, it works for them. So, that's number two. Then there are those who feel that, how can we say that me doing okupe, I have COVID. God forbid, I will hide this one. Even if I'm going to die, God forbid, so those are the three categories of people that we have in the country. So we have to keep educating. We have to keep reassuring people. And we have to improve access. We have to improve access. Those telephones don't work. That is the truth. I'm sorry. But, that is what I get calls all the time from friends. Even other people can get my number from other people and all that. And I know what they tell me. Those telephones do not work in most cases. Right. So, if you are just on your own and you telephone and you try to go somewhere and nobody is answering you, then you have to just resort to something else. So that's the problem.
Indeed, Dr. Okupe, once again, congratulations. I don't think I can say that enough. Congratulations, and it's good to see you back fully to your feet. Dr. Okupe, of course, former spokesperson to the president of Nigeria. He's still, of course, a serving politician, so I must still say that. But, of course, he is as well a medical doctor. Thank you so much for your time this evening.
I'm grateful, Adi. Nice. I'm happy to be here.
Thank you very much. Okay. Thank you. Now, according to the Nigeria Center for Disease Control, the NCDC, 4 deaths were recorded in the last 24 hours in 4 states: Edo, Lagos, the FCT, and Osun State. And this brings the total number of deaths to 774. 224 people were also discharged in 13 states: Rivers, 73, Edo 40, FCT 20, Lagos 19, Plateau 16, Adamawa 12, Akwa Ibom 12, Kaduna 11, 7 in Kebbi and Ogun, Imo 4, Kano 2, and Gombe 1. With 595 new confirmed cases within a 24-hour period, this brings the total number of confirmed cases in the country to 33,153, with more than 183,000 samples tested across the 36 states and the Federal Capital Territory. More than 13,600 people have been discharged so far. Let's talk to Dr. Alera Roberts, who joins us via Skype from Ikoyi in Lagos. Dr. Roberts, thank you for your time. Welcome.
Thank you very much for having me. And can I join you to say congratulations, Uncle Doing? I knew exactly when this was happening. Congrats. This is fantastic news.
I'm sure he's extremely pleased at that. And maybe that's where I should begin. Not as many people as one would expect or would have liked are doing what Dr. Okukpe is doing, which is talking about what he went through and what he's going through now. Is this one of the key problems we have in being able to get a handle on this virus?
Well, it's actually a generalized problem with our culture, with our people, with any kind of disease, because many of the problems we have to face, health problems we have to face when people say, but there's not enough awareness about this. It's usually because people who are going through it or who have gone through it and overcome don't want to be identified with it. There's this sort of concept that you're somehow a failure, or you're a sinner, or you've done something wrong. And this is the problem we've been facing. I mean, I guess one could understand with diseases like HIV/AIDS, but diseases like Ebola and certainly now COVID, where, as Dr. Cooper said, it is not anybody's fault. We're all human beings. For as long as you breathe oxygen and you bleed blood, you are susceptible to this virus.
Now, one of the things Dr. Okukpe mentioned, which I'd like you to take a look at now strictly from the medical perspective, now talking about those who do the treatment, not those receiving the treatment, but those who do the treating, is that when you recover from COVID and then you are asked to, you're told that you've got 2 negatives and you can now go home, you're COVID-free. What's the post-treatment regimen like? Are they put on a special diet? Are they asked to do particular exercises or anything like that?
Well, as he quite rightly explained, there is that period, that the longer period of recovery, where you find that your breathing muscles, your limb muscles are not as strong as they used to be, and you are unable to do a lot of things. And we know that people should be advised by the physiotherapist, particularly should place you on particular exercise regimens to strengthen your breathing exercises and to give you particular exercises for the arms and the leg muscles to recover and to strengthen. And these exercises need to be tailored to the patient. Because like he said, if you're an older person or you have underlying health conditions, they would structure an exercise regimen for you. Most and generally, no, this is not being done because we simply don't have enough health personnel to carry out all these things. I mean, I know in the teaching hospital, because we have a consortium of, specialists across all the cadres of medicine, it's more likely to happen. But if you were admitted into an isolation center, where the chances are you only have the frontline workers, the particular emergency physicians and nurses looking after you, it's very difficult in between donning and doffing the PPE for them to give you a very complicated, and they have to be knowledgeable in it too, which is usually the job of the physiotherapist. But most and generally, you can get that general information, eating well, sleeping regularly, taking your multivitamins, getting out and doing some gentle exercise, walking and whatnot. Don't try to get back to your pre-morbid exercise levels. You have to work your way through slowly. But there are enough resources in the Southwest, certainly, professionals and specialists that you can talk to who could give this kind of information.
Now, when you're asked to go home, when you're discharged, of course, everybody's quite happy for you. And Dr. Cooper made a statement here that I want you to re-emphasize, if that's what it is, that if you've had COVID and you've successfully recovered from it, the idea is that you now have the antibodies in you, and that it is your chances of getting COVID a second time are much lower.
Well, no, I'll have to disagree with him on that, because we were just reading the research, my husband and I, this morning. In fact, yesterday it came out that a cohort of patients who are being followed in the UK, 3 weeks after infection that was diagnosed and confirmed by PCR testing, 3 weeks after infection, 60% had developed 60% immunity. But less than 3 months after that, that 60% had dropped to 17%. And it's the reason why, despite the number of recoveries that we have seen, we haven't yet achieved the herd immunity that the WHO and other health experts are talking about. Because that herd immunity is a critical number where it would be that the number of people in the herd, i.e. in the population, who have developed antibodies are enough so that even if there are people who are susceptible to the disease, the virus can't transmit to them because it's sort of held back by a herd of non-susceptible people. We're not seeing the development of that herd immunity 7 months into the disease. And if you will recall, looking at the experiment of Sweden, Norway, and the UK, if you recall, Sweden didn't lock down, didn't close schools or bars in the hope that they would allow the virus to flow through the population and develop herd immunity. That did not happen. Their mortality rates are just as high as the UK and the US, and they also have the crashing economy. So that issue of immunity after the disease, yes, it is less likely that they're shedding the virus immediately post-disease, but I would still strongly, strongly recommend that the non-pharmaceutical interventions are still maintained. Wearing a face covering, hand washing regularly with soap and water, and maintaining a physical distance. Simply because you've had the disease of Okudo, it's not the time to go to Owambe party. Please.
To be fair to Dr. Okukpe, he did say that his immunity would be lasting at this point, but he didn't think he didn't know how long it would keep lasting, which is more or less that what you've said. Yeah. Now let me ask about something else that, you know, depending on, I mean, if you're not a medical doctor, this is quite controversial, and some would say, ew, you know, why? And that has to do with the idea of taking plasma from people who have recovered from COVID-19 and using it for the purposes of treatment of other people. Is this feasible? Is this something that is being seriously considered or even being done?
Well, it actually is in trials. There are several clinical trials that are looking at it. Plasma transfusion will be similar to a blood transfusion. So, it's something we've been doing pretty much ever since I know. Blood transfusions are a major life-saving procedure well before the advent of COVID-19. And plasma transfusions and transfusions of blood products is a major life-saving procedure. So yes, the issue of transfusing the plasma, what we call, it's called something, the plasma of people who have recovered from COVID-19 is, yes, it's something that is being looked at in trials to see whether it does confer some immunity, it confers antibody levels, or shortens the course of the disease.
Thank you so much, Dr. Roberts. As always, this has been a most enlightening conversation. Most of the time we talk about what happens to people up to the treatment stage, but today we've taken it much further. Thank you so much for your time. Dr. Roberts joined us via Skype from Ikoyi in Lagos. Thank you so much.
Thank you for having me.
Outside our shores, infections have been rising rapidly in about 40 of 50 American states over the last 2 weeks, as the United States remains top with the world's highest number of confirmed cases and deaths. The U.S. state of Florida today reported a new record high of 132 additional COVID-19 deaths, as well as more than 9,100 new confirmed cases. More than 4,400 people have already died from COVID-19 in that state. Our Washington, D.C. correspondent, Maria Bird, has more.
One antibody drug is in its final phase of testing, and many Americans are hopeful that this could show some relief toward COVID-19.
The U.S. government invests $1.6 billion in Novavax to fast-track a potential coronavirus vaccine with the hope of being able to deliver 100 million doses in the U.S. by the beginning of 2021.
And we expect to have all 100 million doses done by, so let's say, January or February of next year. And that, importantly, puts us in a position, because 100 million doses isn't enough for the U.S., much less the globe. But it puts us at a scale where we can make, perhaps in the U.S., 500 plus million doses next year. This is the type of scale and capacity that we need to take care of this pandemic.
Not only is the U.S. fast-tracking a vaccine, but has recently signed an agreement with Regeneron to fast-track the development of a COVID-19 therapy which could both treat and prevent the coronavirus. This drug is currently in clinical trials and could be ready as early as the end of the summer. As vaccines and therapies are being fast-tracked, coronavirus cases are surging in the U.S., and states like California are rolling back their reopening.
Today, we are announcing additional statewide actions as it relates to our stay-at-home order here in the state of California. We are now effective today, requiring all counties to close their indoor activities, their indoor operations in the following sectors: restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos and museums, card rooms, and the shuttering of all bars. This is in every county in the state of California.
The unsettling state of the U.S. coronavirus pandemic has many teachers in the U.S. concerned about the president's call to reopen school in the fall, saying that safety should be our number one priority.
I don't want to get sick. I don't want my family to get sick. I don't want my students to get sick.
As America sits in the first wave of the coronavirus, it is hopeful that by the second wave, vaccines or antibody drugs can be available for students, parents, and American citizens. From Washington, Maria Bird, Channel Television News.
Many other countries and cities around the world are returning COVID-19 restrictions as cases rise globally. From Madagascar and Morocco in Africa to Asia, leaders are realizing they still need to do more to prevent spiraling deaths and spike in cases. Here's our global update.
About the COVID issue, because I just listened to a call
in the United Kingdom, following Prime Minister Boris Johnson's advice that citizens wear masks in confined spaces, Health Minister Matt Hancock announced in Parliament the compulsory use of face masks in shops.
We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets. Last month, we made face coverings mandatory on public transport and in NHS settings. This has been successful in giving people more confidence to go on public transport and to a hospital setting when they need to.
France celebrates a modified but still day today because of the coronavirus. The president, Emmanuel Macron, in a rare television interview, said he would like to see face masks mandatory in all public enclosed spaces and that this could come into effect on August the 1st. Australia has tightened restriction movement as authorities struggle to contain a fresh outbreak of COVID-19 in the country's southeast that has pushed the national tally of cases beyond 10,000. The changes come as scores of new cases were uncovered in Victoria, the country's COVID-19 hotspot, despite a return to lockdown last week for nearly 5 million people in the state of Melbourne. Over in the United States, California Governor Gavin Newsom's decision on Monday to reimpose restrictions on bars, restaurants, gyms, and even ordinary office work to tamp down a surge of coronavirus infections is dimming economic growth prospects for the nation as a whole. The Golden State, with 40 million people, employs more workers than any other state in the nation, and its production of goods and services is about equal of the combined output of Florida and Texas, two other states that have also seen resurgences of the virus. Over in Africa, Morocco's Tangier city has become the latest to go back into lockdown. In Latin America, the Colombian capital Bogota has been placed under a 2-week lockdown, and in the Middle East, both Israel and the West Bank have reintroduced restrictions in response to a rise in cases.
We can now talk to our Washington, D.C. correspondent, Maria Bird, to take a look at the situation in the United States reported on earlier. Maria, good evening. Thanks for joining us from Washington.
Good evening.
Florida is fast becoming America's latest COVID-19 epicenter. Several towns and counties are reimposing lockdown measures. Why are we seeing a spike there?
From what we're hearing from all the medical experts is that it's a resistance to wearing masks, and it's a lack of pretty much the governors putting down laws in place that are requiring individuals to wear masks when they are in public facilities, when they're going in stores, when they're going inside of hair salons, barbershops. And at this time, not every state is requiring that. So when you talk about epicenters like Florida, where there are 48 hospitals that are without ICU beds, and you talk about places like Houston, Texas, that has seen a huge surge. And we're noting, as we talked about last week, we're noting that many young people are really having to battle through this COVID-19. And a lot of that is just due to the fact that they're not taking the precautions that are necessary to ensure that we curb the amount of the spread.
Now, there are quite a number of states, as we reported earlier, that are witnessing steep rises in the number of cases. Yet, the debate about whether or not schools should open is going on over there, just like it is here in Nigeria. What are you hearing? Are people willing that this risk should be taken, especially against the background that in other places where schools had been opened, some of them have had to go back?
Yes, you're seeing parents and you're seeing really teachers and administrators that are being outspoken and saying that they cannot put their lives at risk and the lives of the young children at risk, because the reality is the studies have not shown yet what are the long-term impacts. We know that children are less likely to have the effects that many elderly have had with ICU and very devastating cases, but children can still be impacted. And again, we don't know what could happen to a child or anyone 10, 15 years down the road if they are contracted with COVID-19. And so many people are asking the federal government to pull back and to really implore and to suggest that many states do not reopen school in the fall, which is just about 6 weeks away from now, but that they do wait and allow virtual school to begin for the fall.
There is increasing COVID-19 infections in the immigration process itself. People who are detained, more and more of them are testing positive for COVID-19, and even those who are in the staff role of immigration are also doing the same. Now, what exactly is going to happen here? What are people doing? What are the authorities doing to either prevent or reduce the spread, particularly in detention centers?
The unfortunate part is that the detention centers, most of the ones you're speaking of when you talk about immigration, are federally run. And we know the federal government is really working hard to try to dispel the myth that COVID-19 is going to have this long-lasting impact. They're really trying to push people to reopen and to bring the country back to normal. And again, we know that social distancing and wearing of masks is one of the #1 ways to end the spread. And so in these facilities, you don't have the 6 feet distance. You don't have the ability to have people spread out. And so you're not going to really see a curb in that unless the government really takes harsh measures to either begin to start sending people home, beginning to allow people to get with their family members that are here in the U.S., and remove some of the restrictions that have been put in place by ICE.
Thank you so much, Maria. Maria Bird, thank you for your time joining us this evening from Washington, D.C.
Thank you.
From the NCDC, evidence on airborne transmission of COVID-19 reinforces the need for strict adherence to preventive measures such as avoidance of mass gatherings and use of face masks as it continues to adapt the guidelines as scientific evidence emerges. On the NCDC website, you can find the latest national strategy on flattening the curve as the website comes alive with all the information and statistics. with regular updates on COVID-19 regulations and several guidelines as to how to efficiently self-isolate and what it means by social distancing. You can also access emergency contacts if you need to. A live feed of the World Health Organization's website also has regular updates about the spread of the pandemic. The WHO has strategy guides which push forward the public health response at national and sub-national levels, including practical guidance for strategic action tailored to the local context. You can also take a closer look, that is, at some of the numbers in real time. Our website, channelstv.com, is alive with story updates, not just of COVID-19, but indeed all other stories, the news behind the news and the figures behind the news. That's our COVID-19 update. I am Ladi Akiri Duluale. Good night.